I ask Dr. Smith to come up. Dr. Smith is an MD with emergency medicine. He's also with the International Lyme and Associated Diseases Society and a member of the Lyme Disease Guidelines Committee of 2004. Doctor, whenever you're ready.
Thank you for this opportunity to speak on the experience of a community physician in Pennsylvania with tick-borne diseases. I think we've had enough testimony about, is Lyme disease a serious problem? It certainly is in my office. I'm going to touch on what my experience is about problems with the healthcare system, about Lyme disease in Pennsylvania. Why aren't the germs cooperating? What's wrong with the germs? Why aren't they easily killed in 2 to 4 weeks? And what is the evidence? We hear a lot among physicians about evidence-based medicine. And so I want to speak about the evidence of chronic Lyme disease, and then I want to give about 10 reasons why to support Bill 272 from a physician's point of view. As a physician, I've worked totally in Pennsylvania in my healthcare profession for 35 years. The last 10 years I've been involved with Lyme and tick-borne diseases. I've seen and been involved with about 1,000 Lyme disease patients. These patients enter my practice either because they were treated short-term and got sick again, were inadequately treated, were never diagnosed or treated, and many years have gone by. I lecture at Lyme Disease international meetings. I published on Lyme disease, and I was a co-author of the original ILADS guidelines. Is Lyme disease a serious problem? The number we have is 5,000, and the estimate is there could be 50,000 patients each year in Pennsylvania with this disease. There could be a lot more. I don't know if that's not reported or not diagnosed, but it's probably the tip of the iceberg. It's in every county in Pennsylvania. It has a severe quality of life impact. The number of deaths may be fairly low, but the death in your quality of life is very real. The costs, let's add up some costs. I mean, if it's $20,000 a year per patient and you have 50,000 patients, that's $1 billion in Pennsylvania. And I think $20,000 a year is coming in on the low side when you look at the previous testimony. The costs in pain and suffering have already been documented in studies to be equal to that in heart failure, post-operative pain, multiple sclerosis. The conclusion from a doctor's office treating Lyme disease is our present approach is not working. What's wrong with our health care? The major problem I see is delay in diagnosis. The disease, when it's early, is one disease. When it's late, it's a totally different disease. Later disease is much more serious. The delay is due to a lack of public education. The patients don't know enough about Lyme disease. They're going to learn, but they don't know enough to begin with. And secondly, physician education. A major other problem is this reliance on the testing. So many of my patients have seen another doctor or many doctors previously, and they said, we'll do the test. The test is negative, you don't have Lyme disease. I'm going to tell you, this test doesn't even test for Lyme disease. A test for Lyme disease would find the germ, and it would show you how you're sick from that germ. This is a test that sees if you have antibodies that'll stick onto a strain of a germ in a kit. So the result is open to interpretation. That's what it's worth. It can be supportive of Lyme disease or less supportive. It is never and has never been diagnostic of Lyme disease. Second major fault is relying on very narrow presentations of Lyme disease. Lyme disease is listed as 5 problems that can be reported. Those are the tip of the iceberg. Every one of the reportable conditions, medical presentations, is the tip of the iceberg. Complete heart block is a heart manifestation that can be reported. Holter monitors of people with Lyme disease show over 10 times as many other arrhythmias, predominantly atrial, building up to the final catastrophe of complete heart block. But they're just tremendous. Bell's palsy is one of 12 cranial nerves coming out of your head. Any one of those cranial nerves can be involved. It's just that Bell's palsy is easy to see when you look in the mirror or walk in your doctor's office. Every one of these criteria that are listed are just the tip of the iceberg, and that's based on evidence. Another problem is care isn't available to patients. Patients have to struggle to find someone to give them an option to look at this disease the way it really is. Another major problem is healthcare. Like all of us humans, we get a vested interest in what we've been doing, and it's very hard to change. And there are vested interests in Lyme disease. I'm going to give you a 30-second microbiology course. But if you learn about Lyme disease and what this germ does, you will walk away from your learning that this germ is not going to be treated with 30 days of anything when it's chronic. I don't care if it's antibiotics, or if it's the autoimmune presentations, or if it's the psychiatric presentations, or it's the autism in your child. This germ is not going to go away in 30 days. Now, I mentioned a list of things there, but it's inside cells and outside cells. If you treat it, it can go dormant. A small number of these germs can make you terribly ill. And they do it, as Dr. Bransfield mentioned, by driving large waves of cytokines. Your own immune chemicals make you sick. They're supposed to. When you get sick, you're supposed to go lay down and don't infect me. And go hurt so you don't waste your energy, digging potatoes. Go lay down and get better. Those are normal responses in the cytokines. But if you can't get rid of a germ, you've got the flu every day. The only difference is some days more hell than another day. We know that the co-infections in these germs and these ticks support each other. The more you get, the sicker you are. And our present lifestyle in Pennsylvania interplays with this illness, making it more serious than probably it was for Susquehannock Indians. Our own antibiotics aren't working. So why would an external source of antibiotics work in 30 days? You make your own antibiotics, and they're not working. So short-term treatment of any kind is highly questionable. And a patient came to me, I should at least offer them the option. This is what we know about the disease. Do you want to go with the short-term? Do you want to go long-term? What's the evidence we hear? We hear these statements that this disease is cured in 2 to 4 weeks. The serology tests are accurate. And two really bad things I have to deal with in my office is there's no proof that long-term antibiotics work and that they're dangerous. Well, first of all, the IDSA guidelines themselves, which make these statements, are based on very inadequate evidence. There are two different schools of thought on this disease. The counter evidence, even at the IDSA panel meeting in 2010, tremendous evidence was given that short-term treatment is not effective. There are many studies showing success with longer-term treatment. When a statement is made that there is no evidence that long-term treatment works, that is not the fact. I listed several studies up there, but these go back 20 years. Elizabeth Aberer was a German physician who kept needle biopsying around joints as she treated her patients. And every 3 to 6 months, she saw less germ and less inflammation. But it wasn't even really all gone in many patients, even at the end of her treatment. Barthold and Husick recently did excellent work with mice. They treated them with 30 days. After 30 days, every mouse was infected. When you looked for the germ by DNA, by electron microscopy, or by feeding sterile ticks on the cured mice, they gave it to new mice. The CDC itself talks about co-infections, how they complicate the picture. The cyclical pattern I want to mention is the evidence in my office. When you treat patients, you diagnose them by patterns. When somebody walks into the office or the emergency room, nobody looks at you and goes, IVP, CAT scan, PET scan, what's the pattern of your illness? Chronic Lyme disease presents with horrible fatigue, horrible pain, and broad neurologic problems. That's the triad. It's so common, it's boring. Now there are individual variations. Some people's pain's in their head, some it's in their bladder, some it's in their back. Everybody has core energy lack, and everybody has neurologic problems. But the pattern of improvement when you treat these patients is the opposite of normal. They feel sicker first. The germ has them pinned down. You give the patient an antibiotic they haven't seen before, and they escape from being pinned. It's up fighting. You feel sicker first. Then you start to see a second pattern of improvement, and a third pattern where you finally are stable. Almost everybody with chronic Lyme goes through that picture. It's a pattern. It's evidence. In vitro research, if you keep culturing these germs and treating them, they appear to go away. They're dormant. What can 272 do for Pennsylvania? I think recognize the diagnosis is on broad criteria. The negative tests don't exclude it. New illness isn't the same as chronic illness. There is a triad of the pattern of the illness, and later stage treatment is complex. If you stop too soon, it comes back. And the benefits of treating long-term illness with antibiotics long-term far outweighs the risks. And government intervention in healthcare here, in my experience, is appropriate, and there are precedents. If I'm in a car accident going home, I go to a trauma center. That was set up by my government. If someone has breast cancer, there's a law in Pennsylvania that says you will be given options. The availability is constrained by many things. I would like to see a clinic set up in Pennsylvania where we could treat patients at low cost and offer them at least a modicum of care. Patient choice is essential. A patient has to be given options of what to do. And I think we have to be aware that vested interests are what can be blocking our progress. Summary, I think the main summary for me in my office is that Lyme disease is exciting. What do you mean? It's treatable, it's preventable, and we can do that. The savings in suffering and cost of Pennsylvania is an exciting issue. I mean, what if lupus in some patients is Lyme? MS is Lyme in some patients. Scleroderma is in Lyme in some patients. I'm treating patients from Johns Hopkins. They're still getting treated there for scleroderma. They're getting sicker. I get them and treat them for Lyme disease. They slowly, steadily get better. So I think it's exciting for us what we could do. Thank you for listening.
Very good, Doc.